Welcome everyone. Thank you so much for attending our webinar. I just want to tell you how much I appreciate you guys taking the time out of your day to be here. I'd like to introduce beautiful Dr. Peterson. We are at her beautiful home office in Houston, Texas, and we are delighted to have you with us, Dr. Peterson. Thank you so much for sharing so much information today about Ultherapy.
Well, we're so happy to have you here with us today. Ultherapy has been so successful in our practice, and it really serves as a foundation around which so many of our other procedures are built upon. Our patients here in the Texas area, they really do prefer low downtime procedures. So anything that we can do that can give them amazing results without any downtime is just perfect for their lifestyle.
Thank you, Dr. Peterson. Clearly you've been using Ulthera a while, and I know you see the value in it. What do you think really contributes to your success using the device?
Well, one of the things that's helped with our success is multifactorial. One of the things is Ulthera continues to have new advancements in their technique. They help us to be able to learn these new techniques. There's been a variety of new indications that have come up over the last few years. Originally we had the brow lift, but now we are able to work on the neck, the chest, and then off-label we also use it on the body as well. The other reasons it's been so successful is that it's a non-invasive treatment with no downtime. So again, it's very easy to allow our patients to incorporate this into their life. But it's effective, and so that's one of the other things that keeps our patients coming back to us and has allowed us to build on our practice because they're happy with the results. They're now confident with what their doctor can give them, and so they're interested in other procedures. So again, the Ulthera is serving as the foundation.
What do you think contributes to your success or keeps patients coming back?
Well, I think it's a variety of things. One of the things is that the patients are finding that this is a very effective treatment for them, and they're seeing the good results, which gives them confidence also in our skills. And so they come back and they're really looking to be able to do a very 3D or a comprehensive approach to anti-aging, and that involves fillers, it involves neuromodulators, lasers to help to improve brown spots and redness, and then of course a very comprehensive skincare regimen for them to use once they go home. But then the other things have been that when we first started with Ultherapy in 2009, we just had the brow indication, but now we are able to work on the neck and the décolleté. And so as Ultherapy has brought out these other indications and clearances, we've been able to start doing all of these treatments in our patients. So it helps them also to keep coming back to our practice because we have a variety of other treatments that we can do for them.
That's great, Dr. Peterson. I can see how this has become a really successful procedure for you. What do you think has kept your system so busy?
Well, one of the things is really going down to the consultation process. When our patients come in, we want to talk to them about what do they like, what do they not like, what areas are they looking to improve upon. And again, this gets back to us being able to develop that comprehensive 3D anti-aging plan for our patients. So we're going to use as our foundation the Ultherapy to be able to lift and tighten tissue, help to reposition the brows, help to lift some of the jowling and tighten up the lines on the décolleté. But for our patients who do have brown spots, then we can use our lasers there. Many patients have, as we know, have volume loss as part of the aging process, so we oftentimes will combine our volumizing fillers to help also augment the results and give them even better results. So then the next thing that we do is we really talk to our patients about what the plan is going to be. How are we going to get all of this organized? Some of the procedures we can do on the same day, and then others are going to need to have multiple treatments. For example, the patient can have their Ultherapy and IPL on the same day, but then they come back and follow up for 2 more IPLs. We go over the budget, we make our schedule, and then we go forward and get the patients treated.
Okay, so that brings me to a question. How long does Ultherapy last?
It really can depend on the patient. Oftentimes we find that our younger patients, it's lasting a lot longer. We can see in this photo of this woman here who's in her mid-40s that her results are lasting at least 450 days.
Wow.
And it oftentimes we see even better results when we are doing more of the comprehensive anti-aging plan and using the Ulthera as our foundation, because then we're just going to be able to have even more long-lasting results because we have multiple procedures that are working together synergistically to go ahead and build collagen and give our patients the best results.
So you mentioned the consultation process. That really covers all of your patients' expectations and needs.
So we really want to individualize this treatment plan for our patients' needs. We think about the R's of anti-aging, so that's relaxing with the neuromodulators, refilling and revolumizing with our fillers, redraping, and we're doing that with our Ultherapy to tighten and lift the skin, similar to using shrink wrap. And then also we want to help to retexturize, and then finally we want to be able to keep these results going again with the skincare.
Okay, so the next question is, can you walk me through the entire consultation process?
Absolutely. Let's go head over to the consultation room.
Perfect.
So the first step of the consultation process is really trying to understand what are your needs, what are your goals. So what led you, Jamie, to want to have the Ultherapy procedure done?
Well, I've certainly heard a lot about it. I'm very familiar with Ulthera and how it works, and more importantly than just learning about it on my own, I've heard from friends and colleagues who have had it done that they really enjoyed their experience, and more so they enjoyed the results that they received. So I'm looking to maybe get the same kind of results, that young, fresh look.
Very good. And so this is something we hear a lot from our patients. A lot of times it is by word of mouth. A lot of their friends will have had it done, and maybe that one friend is like the Pied Piper who gets the whole thing going, and then all of their friends come in afterwards. Other patients hear about it through the media. The media is always talking about Ultherapy as this great new breakthrough treatment. And as you may have heard, and with some of the research that you've been doing, is Ultherapy uses ultrasound energy, and it allows us to use this ultrasound energy to target the same layer that plastic surgeons work in during a facelift. So it's really a nice device to be able to help, again, refresh your skin, lift and tighten.
Well, certainly I work with about 2,500 beauty experts, so I definitely want to keep that young, refreshed look as long as I can.
I think that's definitely obtainable. Not only are we able to use the Ultherapy to help to tighten and lift your skin tissue, but we can also develop a plan where we can address some of your other needs.
That's excellent. So for me personally, is that what you'd recommend? What kind of plan? Would it include neuromodulators and Ultherapy as a base?
For you, I would actually recommend the neuromodulators as well, and to continue to do those every 3 to 4 months as needed. With the Ultherapy, it's something that we're probably going to look at wanting to do on you at least once every 1.5 to 2 years, just to continue to keep that skin tightened and the collagen building. In between that time, the skincare regimen is going to be essential to help with collagen growth, helping to reduce fine lines, reduce brown spots. And one other thing I would suggest for you, if you wanted to consider it, that we could do at the same time as your Ultherapy, is something called an intense pulse light, or IPL. It's a very easy downtime, very easy low downtime procedure that uses light energy just to help reduce some of the brown spots that I'm seeing on your face.
Wonderful. Wonderful. I'd like to do all of that.
Okay, sounds good.
Perfect. Okay, so from a business perspective, not a patient perspective, I want to ask you, how has MERS Ulthera been supportive in helping you promote this treatment?
Right, in our office we have a variety, just a very large number of devices. And so MERS and Ulthera have been so helpful for us. We have our practice manager, Pam, who we love, and she's so easy to work with. She helps us on the marketing standpoint, helping to organize events for us. But then on the other standpoint, she also helps to keep us very informed when new indications are available or new protocols are developed, and helping us to improve our skills and help to develop our advanced techniques as well.
Okay, so Dr. Peterson, now that we've discussed the procedure, what do we do next to get started?
Well, Jamie, you're going to have to lose some makeup. So we're going to go ahead and have you wash your face, and then we're going to get some photos, and then we'll come back in here and we'll look at the photos and talk to you a little bit about what we're seeing and how to make very good, consistent photos, which will really help with looking at your before and after photos when you come back to see me in 3 to 6 months.
Okay, I hate to do it, but let's get started.
Okay, sounds good.
Okay, I took off the makeup, I have a fresh face. Be brutally honest, I know we're here to do a consultation, so you can tell me what to improve, what I need to do differently. What do you see in my face? What can I do to enhance my image, look younger, all the great things that I've been telling you about?
So I I like to do a top-down approach. It's just the easiest for me. So when we look in the mirror, and you can look here, we can see that your right brow is just a little bit lower than your left brow. We can improve that not only with neuromodulators, but actually doing Ultherapy. So what we would do is we would focus with a few extra lines on the right brow, more so than what we're doing on the left. And over time, we can see that that can lift and we can get a little bit more symmetry of the brows. One of the things I would consider. And then as we move down the face, when I see that you're talking to me and smiling, you have a little bit of crow's feet, I have them too. So a little bit of neuromodulators there can also help to improve the appearance of those. Next, as we move further down onto the neck, when I looked at your side profile, there's a little bit of laxity, a teeny bit of fullness that is starting here, and that may be a little bit more something that you see even in your mother or some of your aunts, and that may be a little bit of a family trait that's already starting to begin. So a little bit of Ultherapy underneath the neck would be nice to help to tighten and lift under the neck. Now as we go down the neck, your lines, you are looking perfect. So you don't have any lines on the neck. It looks perfect. So I don't think that we need to continue your Ultherapy all the way down the neck for you. The last thing, like we were alluding to earlier, is the IPL. So the intense pulse light. You do have, just from all your prior sun exposure, a couple of sunspots across the face, also on the neck, and there's also a little bit of some early what we call rosacea or redness on your chin, on your cheeks, and your nose. Also another common thing that we see in families. The IPL can help to address all of those issues. That would be my recommendation.
Perfect. Well, I appreciate you being honest with me. I've certainly, I've heard some of those assessments before, definitely about the eyebrows. So I'm looking forward to seeing what Ulthera can do for me.
Perfect. That sounds great.
What do we do next after we've taken the photos as we get near the treatment?
Right. Well, the one thing we want to do is just make sure that we have good quality photos. Consistency is so important with all procedures, but especially when you're looking at a skin tightening treatment. So one of the things we're looking for, we're doing 5 views, and we want to make sure that your head is in a good position. So we see that your eyes are nice and bright and awake. They're nice and open and looking straight ahead. And then also when we look at from the tip of the nose to what we call the tragus, that this line is nice and parallel with the ground. And that will help when patients come back to be able to set them up in the same position again so we can see the improvement. And really, our practice managers are really helpful at coming in and helping to teach our photographers and our nurses how to get these nice, consistent shots. And the last thing I was going to go ahead and just go over again with you, we had talked a little bit about how that trait that you have in your family, a little bit of laxity. So you can see how important it is to take all 5 photos because it's really seen best in 2 of the photos, your profile image. So now that we've gone over your photos, we see that we have really nice, high-quality photos. Let's go ahead, go get you marked, and get you to the treatment room.
Perfect. Let's
do it. Okay. All right. So Jamie, what we're going to do next is we're actually going to draw on you. We're creating a little map for ourselves so we can see where we want to treat and where we don't want to treat. So the first thing I did was I just marked a little line on the midline of your chin. And then what we're doing next is just tracing out your jawline because there are some areas that we want to avoid, and that includes actually going over the bony surface because it can be a little bit tender and there's a few nerves in that area that we also want to avoid. We'll have you turn to this side. Perfect. So we'll just do the same thing along this side, and then I'll have you put your head in the midline once more. Then we're going to feel for your thyroid cartilage. We're going to mark that line. And then we're going to move laterally, straight outwards. What we want to do is we want to avoid treating over the trachea and over the thyroid gland. So that's why we're starting our mark right there at the thyroid cartilage. This midline area is probably the area that Jamie has the most amount of laxity on, so we're going to really focus a lot of our energy in this area. Typically we can get anywhere from 2 more columns, sometimes 3 depending on the patient's neck size on each side. So the next thing we're going to do, Jamie, is we're going to put a little bit of ultrasound gel. It's a little bit cool onto the skin surface. I like to rub it in really well because we don't want to have too much ultrasound gel or it can affect some of your procedure and not have us as good of a scanning. So the next thing we're going to do is we're going to start with the transducers. There's a couple of different transducers that work with the Ultherapy. We like to start with the deepest one, and then we work up towards the top layers of the skin. And our first goal is that we want to be treating the patient in what we call the platysma. And so the platysma is a thin little muscle, and it has a thick layer of collagen on top of it. So we're using the Ulthera to help to tighten this layer by causing some heat that will be accumulated in the skin tissue, and that forms an immediate skin tightening effect. And then when we look at this image, we see just perfectly that your platysma is right at 4.5 millimeters depth, which is just perfect. So we're going to deliver your energy here. And then we're just going to gently and very slowly move down your submental area. Now with the protocol that's developed, it recommends that we deliver 30 lines in the submentum. One of the things we want to do is make sure that we're not applying too much pressure for a couple of reasons. One, it can actually cause the treatment to be a little bit more painful for the patient, but the other thing is it can push the tissues downward, and then we're not in our exact treatment zone, so we're actually treating the postplatysmal fatty tissue. Other things that we were alluding to earlier that we can do to help with the patient and help to keep them more comfortable is we can use a little bit of vibration massage. So we're going to show you what that looks like right now. So what we're going to do is to help with some patient comfort. We like using some of the other distractors, and one of them can be with vibration. Mm-hmm. So what I'm going to have you do, Jamie, is I'm going to have you lift up your shoulder. This is kind of the easy way I like to do it, and then rest your shoulder back. And you can feel that vibration. Yeah. So we're going to let that vibration kind of trick your nerves into feeling vibration pressure instead of discomfort. Some of the things that we're able to see, what is so nice about this device, is it allows tissue visualization as well. So we're able to see the epidermis, which is the top layer of the skin. The next layer down is called the dermis, and it looks kind of light gray, kind of heathered in effect. Underneath that is the subcutis, where the fatty tissue is. So then the tissue on the ultrasound device looks dark, kind of blackish, almost kind of blackish and a little bit bubbly. The next layer down when we're working on the face is going to be the SMAS. Otherwise, on the neck is the platysma, and it has a bit of a whitish appearance, kind of a whitish to gray appearance. If we see something that looks really bright white and thin, that is actually the bone, and like we talked about earlier, we don't want to treat over the bony surface. Now the device is going to make a little ding right there, and that means that we're at 30 lines. Perfect. Well done. So Jamie, now that we've completed the 4.5 millimeter depth and we've worked here on your platysma to help to tighten the skin and begin having some tissue contraction, we're now going to move up and we're going to treat you at 3 millimeters depth. So most of my patients will say that when we're treating at the 3 millimeter, it's much more comfortable than the 4.5. So I think they'll be quite comfortable for the rest of the procedure. Yeah. So I always tell patients, you know, we got through the hardest part. Now it's going to be more comfortable for you. Now again, like we talked about, we want to make sure that we always have really good visualization and that we have good coupling of our device with the skin surface. We want to avoid seeing in between the epidermis and the top of the scanning device a big black layer. That means that there's too much ultrasound gel. How is this one feeling?
I can barely feel it.
Okay, perfect. See, it's definitely a lot easier.
And the 4.5 wasn't that bad either, so.
Okay, so we just have 10 more, so we're in the final countdown, Jamie. We'll get a little bit more ultrasound
and then I'm going to look
gel.
like Jennifer Aniston?
Exactly. Perfect. We
All
hear the
right.
ding and we know that we made it through. Good job. So as far as, you know, what to expect after the treatment, it's normal to feel a little bit of firmness and tightness. It means the device is actually starting to work. We're getting some of that immediate tissue contraction. As far as what do you need to do when you go home, really you can do whatever you want. So you can go work out today, I'm fine with that. You can put makeup on, you can resume your normal skincare regimen. Right. There's nothing that you need to take afterwards. You're not going to need any Tylenol or Advil. It's going to be really easy for you. Perfect. Now, one of the things we're going to want to do is make sure that you come back in 3 months and we're going to take those fun little photos again. Mm-hmm. Again, we're going to be making sure that we have our very consistent photos so we can really compare your before and afters very well. Do you have any questions for me, Jamie?
No, I really appreciate you taking the time to do this. It exceeded my expectations. I didn't know what to think, and it felt comfortable, and it's
Perfect.
great. Can't wait to see the results.
I know, we can too, Nard. Thank you.